Every cigarette affects more than your lungs. It may also be damaging your kidneys without you even knowing it. Hello everyone, my name is Dr. Bagha, and on this channel we talk about everything kidney health, from prevention to treatment in a simple and practical way. Most people know that smoking damages the lungs. Many people also know that it increases the risk of heart disease and also cancer. But very few people realize this. Smoking also damages your kidneys. In fact, for people who already have pre existing kidney disease, smoking can speed up kidney damage significantly. The problem is kidney damage often develops silently. You may not feel anything, you may not notice any symptoms, and yet the damage may be happening every single day. So, today I will explain how smoking affects kidney health, why it is especially dangerous for people with pre existing kidney disease, and why quitting to smoke can make a major difference. So, before we talk about smoking, let's first understand something very important. Your kidneys depend heavily on blood flow. Every day, your kidneys filter approximately 180 liters of fluid. They remove the waste products, they balance the minerals, they regulate your blood pressure, and they help maintain overall health. To do this effectively, they need a constant supply of oxygen rich blood. So think of your kidneys like a water filtration plant. If the supply becomes restricted, the filtration system cannot function properly. And the same thing happens inside your body. When the blood vessel becomes damaged, kidney function begins to suffer. And smoking is one of the most powerful causes of blood vessel damage. Smoking damages blood vessels throughout the body. It's not just in the lungs, it's not just in the heart, it's all over the body. And the chemicals that are found in cigarette smoke cause blood vessel narrowing, increased inflammation, damage to the blood vessels, and reduced oxygen delivery. And over time, blood vessels become less healthy, they become less flexible, they become very rigid, and less efficient. What does this mean? This means that less blood reaches the vital organs, including the kidneys. When the kidney blood flow decreases, the kidneys receive less oxygen, they receive less nutrition and less support. And over months and years, this can contribute to permanent kidney injury. Smoking doesn't just affect the blood flow to the kidneys, it also directly damages the kidney tissues. Research has shown that smoking increases your blood pressures, it increases oxidative stress, it increases inflammation, and it increases blood vessel injury. Oxidative stress occurs when harmful molecules produced by the body damage your cells. Think of it like rust forming inside the body. Over time, this damages the tiny filtering units of the kidneys. These filters are called glomeruli. When the glomeruli become damaged, they cannot filter the blood efficiently. And as damage continues, you start seeing proteins leaking into the urine, the filtration ability of the kidney reduces, and the kidney function gradually declines. And because kidneys have limited ability to repair themselves, some of the damage can become permanent. Smoking becomes even more dangerous when combined with other medical conditions. So if you have pre-existing diabetes, pre-existing high blood pressure, these are the leading causes of chronic kidney disease worldwide. Smoking makes both conditions worse. It can increase blood pressure further, it can worsen the damage to the blood vessels, and it can make diabetic complications progress faster. Imagine adding fuel to a fire. That's what smoking does. If diabetes is already stressing the kidneys, smoking adds even more damage. If high blood pressure is already affecting the blood vessels of the kidneys, smoking increases that stress even further. And what's the result? It's faster kidney decline. Now, for people with pre existing kidney disease, the risk becomes even greater. Studies consistently show that smokers with kidney disease often lose kidney function faster than the non smokers. This means a faster decline in your estimated GFR, a higher risk of complications, greater likelihood of reaching end stage kidney disease requiring dialysis. And smoking doesn't only affect the kidneys, it also increases the risk of heart attacks, stroke, peripheral arterial disease, and premature death. Remember, people with kidney disease already face a higher cardiovascular risk. Smoking increases the risk even more. Many people think nicotine only causes addiction, but nicotine also affects the body directly. This causes increased heart rate, increased blood pressure, leads to constriction of your blood vessel. So every cigarette smoked creates an additional stress on the cardiovascular system, and every episode of vessel constriction reduces healthy blood flow. When this happens repeatedly, day after day, year after year, the kidneys pay the price. One of the biggest problems with smoking related kidney damage is that it often develops silently. Many people feel perfectly fine until significant damage has already occurred. Possible warning signs include reduction in your urine, increasing blood pressure, proteins in the urine, swelling of the legs, swelling of the face, increased fatigability, and a higher tendency to develop cardiovascular disease like heart attacks. But often, there are no symptoms at all in the early stages. And that is why prevention is so important. Now for the good news. The body begins to recover after smoking stops. It doesn't go back to completely normal, but there is some recovery. And benefits start earlier than many people realize. Over time, quitting smoking can help improve circulation, lower your blood pressure, reduce inflammation, decrease stress on the kidneys, slows down your kidney disease progression, and improve overall cardiovascular health. And perhaps most importantly, it prevents further damage. Many people believe the damage is already done, but that's not true. Stopping to smoke today is still better than stopping to smoke next year. And stopping next year is still better than never stopping at all. So, how do we start to quit smoking? Quitting smoking is not easy. Nicotine addiction is powerful, but support can make a huge difference. Consider counseling, nicotine replacement therapy, support groups, medical guidance, and joining smoking cessation programs. Remember, you don't have to do it alone. Many people need multiple attempts before quitting permanently. What matters is continuing to try. So remember, smoking damages far more than lungs. It affects your blood vessels, it affects your heart, and it affects the kidneys, often silently and often for years before symptoms appear. So if you smoke, one of the most powerful things that you can do for your kidney health is to quit. Protect your kidneys, protect your heart, and protect your future. And please start today. It is never too late to start. If you found this video helpful and would like to support us in sharing this message with those who need it, please like, subscribe, and share it with a friend. Thank you for listening.